Well, I always start with, what are their economic incentives? What are they trying to achieve? Whether it's for profit, increase sales, is it to reduce costs? What is the goal financially? And think about, and then what other goals do they have, for their organization to achieve through the use of digital technologies? And how do you then match them with products and services that are focused specifically on meeting that goal, as opposed to it's cool what they can do, you know? For me, it's always about, endpoint first, and then how do you get there? Everybody loves talking about digital and data, and people are afraid to talk about the dollars, but in healthcare, you really have to follow the money. And if you don't see where the money's coming from and what the financial incentives are of the players, you don't make progress. So if you have a new product to sell, you have to understand who's going to pay for it. If you have data, you have to understand how you can monetize it to the betterment of the group. And really the biggest driver, I think, in the adoption of digital health is the drive to reduce costs in the healthcare system. And also the fact that the cost of technology for these purposes has come down so much. Were it not for those two issues, I don't think we'd be having any of these conversations. But I still was struck by the lack of discussion about reimbursement and adoption, and how still this world, much like the medical device world, is so separated from the health system side of things. And I think these two worlds have to come closer together for the best outcome to occur for the healthcare system overall, patients, providers, whoever. I think the disconnect between the payer-provider side, the folks who control the outflow of money, and the people who develop products and services is still wide. The gulf is still wide. And while many are working with the payers and the providers on pilots and projects and things, there needs to be more co-development, joint thinking about how to reimburse and use new models to pay for things that can deliver better outcome. Well, if you want consumers to pay for things, you're at a good time in healthcare history in the U.S. anyway, because consumers are being forced to pay for things and use dollars from high deductible health plans and the like at a level they've never had to before. And so that's probably the third leg in the stool that's driving some of this digital health economy, is the desire by consumers to find cheaper ways of utilizing that money. When they start thinking about the money as their own, they think about it, how to spend it more judiciously. When they don't care, so just a $10 copay for anything I get, they don't think very much about what the cost of the overall service is. So that's driving, I think, a lot of the opportunity to pay for things, about information, about selection, about picking one doctor or one treatment or service over another. That's a big driver behind that in the digital health world. Well, in the end, it's all about motivation and finding what individually motivates people to make changes and make decisions to do things. And everybody's different. And, I think this is the secret sauce. I mean, you can give people data, you can give people access, you can give people tools, but unless you find what motivates them to use them for the better health outcome, it won't matter. We've seen it already. We've seen it without digital data and digital services. People can make good choices. They can take their blood pressure medication, and mostly they don't. So I think finding ways to engage patients and data and understanding that impact on their body more real time may help them with that. That will motivate some people. But other things motivate other people. It might be financial motivation, it might be family motivation, Lord knows. But it's certainly not a one-size-fits-all outcome. You'd think the biggest motivation would be staying alive, but then nobody would have type 2 diabetes. I mean, let's get real. That's not true. I mean, some of it's a genetic situation. But for the vast majority of people who could avoid type 2 diabetes and do not, it's not like they don't know how to avoid it. It's just very hard not to choose to eat the ice cream. It's very hard to not to choose to eat the bread, and to exercise and do all the things we know we're supposed to do. But we don't. You'd think that, and it's because I think people are not generally motivated long term, they're motivated in the short term.